building a better Bay Area, moving forward, finding solutions. This is ABC 7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC 7, Hulu Live, and wherever you stream. We ask experts your questions every day at 3 to get answers for you in real time. Today, in the aftermath of the Kyle Rittenhouse verdict in Wisconsin, a leading legal expert from that state says the law on self-defense must change. Also, flying over Thanksgiving or Christmas, are warnings of mass delays likely to come true? How can you increase your chances of a smooth traveling experience? An airline and travel blogger joins us with helpful information. But first, CDC Director Rochelle Walensky is expected to sign off later today on the FDA's recommendation to make every adult over 18 eligible for the COVID-19 booster. This comes as California officials are already opening up eligibility, driven by worries over a potential winter surge. But why are they worried? There was a devastating surge last winter, yes, but that was before vaccines. Joining us to discuss this, Dr. Maya Peterson, Associate Professor of Biostatistics at UC Berkeley School of Public Health. Dr. Peterson has been working with the state of California and the city of San Francisco using modeling to inform and guide their policy decisions. Dr. Peterson, thanks for joining us.
Thanks so much for having me.
All right, we often hear follow the science, but you follow not only the science, but also the math. So do the math for us. Why are California public health officials concerned about a winter spike?
Yeah, that's a great question. So I think we are, throughout this epidemic, learning more about the virus and learning more about the vaccines. Now, the vaccines are amazing. We're so lucky we have them, but we have learned that their effectiveness, especially their effectiveness protecting us against infection, really drops off after time. Doesn't mean the vaccines aren't great, but we've learned that really to keep that protection against infection up, it's important to get a booster shot, which is why the news today from the CDC is so welcome. So why are we worried about a winter surge?
Let's go ahead and draw up a graph, because I think that'll help people as you walk us through this graph. So I'm going to ask my producer to do that, and you can explain to us, looking at contact levels and booster versus waning immunity, and walk us through this.
Sure, absolutely. So this is a graph of the little black dots are the actual hospital census, so how many people have been in the hospital over time in the state of California. And this is what we've seen so far throughout the epidemic. And we use a mathematical model to fit those and other data. And then we can use that model to understand what might happen in the future under different scenarios. So the scenarios we look at here are scenarios where protection against infection gets ahead of our boosting, and where we increase our risk behavior a little, a middle, or a large amount. And what we see is if we don't keep up with that waning protection by boosting lots of people, we're really at risk of a major winter surge, even though that we have vaccines. So those are the red lines and some of the green lines on that graph. Now, the good news is if we use the boosters, get them out to lots of people, we'll get ahead of this waning and we'll be able to prevent the surge. And so that's the blue lines you see on the graph. So basically those colored lines show us what could happen under different scenarios and really show us what a powerful tool boosting now can be to help us prevent that surge.
Boy, this is like the multiverse, right? It's like, which one is your reality, is your future? And it sounds like that kind of depends on what we do. So if I'm right, okay, so if I'm looking at this correctly, so like, for example, the 3 red waves, right? The most solid one means low contact with each other. Does that mean we're not socializing that much, kind of doing what we were doing before, minimizing transmission, and that gives you the lowest peak, like the best outcome? Is that what we're saying? I mean, in terms of,
right.
I mean, the best outcome is the blue, of course, but.
Yeah, the red ones are all settings where we don't boost enough to keep up with the waning immunity, and that's right. So that solid red line, that's like if our risk behavior doesn't increase that much over the holidays, we kind of keep doing what we're doing. We don't really know what people are going to do over the holidays though, right? So there's a good chance people might go out, socialize a lot. People want to be with their family and friends. And that's where if we don't boost enough people, we're really risking one of these more major surges.
All right, so based on what we're seeing in terms of travel, it looks like the amount of interaction will be back to pre-pandemic levels. So given that, I don't know if you're calling that high contact or middle contact, and looking at our boosting uptake right now, which wave do you think we are? Like what color and how solid?
Oh, such a good question. Yeah, so I think we have a window of opportunity right now. Boosters kick in pretty fast. So I think, especially with these new simplified eligibility criteria, I think the leadership really that California has shown in this as well, if people go out, get their boosters now, I think we're really in a reasonable place to prevent that surge. But that's why this timing is so important. People are really ramping up to have some more of those contacts, more of that travel, more of that risk behavior.
So if we can put that graph back up, I think so you're saying it's kind of a race against time in terms of getting people boosted, right? Before the immunity from folks who got it 6-8 months ago starts to wane too much. So the best outcome, folks, is the solid blue line, where you can see that's just like incredibly low in terms of cases. If we minimize contact and get boosted, where it really outweighs the waning immunity. But can we talk about that dotted red line that really worries me? Because it looks like it's saying if not a lot of people boost and immunity wanes, we could get a surge or a peak higher than what we had last winter. Is that what I'm seeing?
Well, I think there's two things to note here. One is with the blue lines. I think what's great is that if we do boost enough people, what we can do is we can increase our risk behavior, right? I mean, we can get back to approaching pre-pandemic levels. So we have
right,
this.
Because even the dotted blue line is not that high, relatively speaking.
That high.
Yeah,
exactly. Yeah. And with that dotted red line, I think an important thing to say is, if we started seeing hospitalizations really going up like that, I think risk behavior would change. I think what we've seen, public health actions throughout, I think we would really modify things before we hit that really high hospital surge. I don't think we're headed to a situation where our hospitals will be overwhelmed. But of course, I think we want to prevent having a hospitalization surge at all, especially given that we have this really powerful tool in our hands already. We're in such a different place than we were a year ago, and that's great news.
Exactly. Definitely. We have the vaccines, and it sounds like as long as people are getting boosted, that does allow for a lot more interaction, socializing, being near each other, and I guess that's what your model shows. I want to ask you, though, why is it I'm hearing, even though in the Bay Area, anecdotally, it's very hard to get an appointment for a booster, overall, it seems like a lot of folks, even the folks in the elderly category, are not getting boosted yet in the numbers that I think a lot of public health officials are hoping for. Any explanation for that?
I think there's been a lot of confusion, right? There's been confusion about whether this is the right thing to do. I mean, clearly, there's a lot of discussion about getting vaccines to other countries, which is crucial and so important. I think our lack of vaccine access in other countries has been appalling. But I think people have kind of conflated that with, should I get a booster? I think they're really different questions. So I think people have been confused about that. They've been confused about whether there are enough to go around. There are enough to go around. They've been confused about whether or not they're eligible. And I think we're going to see much more clarity on that going forward. The good news is that we really locally have seen that booster uptake really pick up. And I think that, our local health officials, our state health officials have been doing a good job really getting this message out. We need to continue to do that in the coming.
Look, based on your modeling, it seems like a lot of it is really contingent on boosting. Given that, do you think indoor masking still needs to play a role in this?
That's such an interesting question. I think, first of all, in this pandemic, anyone who tells you they know exactly what's going to happen or exactly what we need to do, you should be skeptical of. And that certainly includes me. I think our model suggests that boosting may have a really important role to play. But there's, I think this virus has taught us humility, right? We don't know the future. I think given that, I wouldn't want to drop all the indoor masking right now. Mm-hmm. I think we should move cautiously. We should keep an eye on the data. We should keep an eye on where we're going. And I think do what, honestly, locally we've done a really good job of, which is being willing to be flexible, being willing to take steps to protect each other, being willing to change our plans. And so I think it's too soon to say, let's keep an eye on things. But I'm cautiously optimistic for the future, especially given, I think, the new eligibility criteria.
All right. What data are you feeding into your model for the waning immunity? Because I've interviewed a lot of doctors who say they don't have concrete good information and data set, especially in this country, about waning immunity.
Absolutely. So I think what we have good information on from a lot of countries, and I don't think there's reason to think that biological aspect is going to be very different, is how much immunity drops off after those initial shots. I think we have lots of really good data from a number of places, Israel, the UK. I think that's not in question. Now, the exact details of how fast it drops off, or does it drop off and then flatten out, or does it keep going down? I agree, we don't know that well at all. And so when we use these models, I mean, that's a sort of a simplified graph that shows 3 scenarios, right? But we look across a whole range of different uncertainties that aren't shown all here, right? And say, under what situations would we be okay, under what situations wouldn't we be okay. So again, we're not saying that for sure, even if we do no boosting, we're going to have a surge. We're saying there's a reasonable risk we could have a surge, and we have this great tool available, so we should use it.
Right. And the conclusion, as I continue to look at that blue line, is look, if we get enough boosting and it keeps ahead of waning immunity, even if we have interactions, we should be in pretty good shape here in California. So, all right, I'll leave it at that. That's the message, right, Dr. Peterson?
That's our take.
All right.
That's our take.
Thank you so much for sharing that research with us. Talk to you soon. Take care.
Okay.
All right, we're going to tackle another topic next, a really tough one for today. We do have reaction to the Kyle Rittenhouse verdict. We'll be joined by a legal expert from that state in Wisconsin who says it's time for laws to change. We'll be right back. All right, everybody, thanks for joining us. As I prepare for our next guest, I'm going to just take a little break here. And you can enjoy a view of the outside. Let's see what our director throws up for you. Can we throw up a lovely outside picture for our viewers on Facebook? Thank you. Kyle Rittenhouse verdict today, not guilty on 5 counts. He had been accused of killing 2 people and wounding a third during a protest last year in Kenosha, Wisconsin, over a police shooting of a black man. Joining us now to discuss the verdict today is John Gross, director of the Public Defender Project at the University of Wisconsin-Madison Law School. Professor Gross, thanks for joining us.
Pleasure to be here.
I think this was stunning to many outside observers who saw Rittenhouse going to that Black Lives Matter protest with an AR-15, admitting that he had answered a call by those on the right to defend. Now, many people see him as a vigilante looking for trouble. How do you explain to those folks why the verdict was not guilty today?
So I think there were a lot of perceptions about Mr. Rittenhouse and his behavior that essentially led people to think that he should not be entitled to claim self-defense. He had a weapon that arguably he should not have been allowed to have legally. He was in Kenosha after a curfew, so he was in a location where he shouldn't have been. And for many, just carrying that type of a weapon, an AR-15 assault-style rifle, is a sort of provocation. But having said all that, and as dangerous as an environment that he interjected himself into under all of those circumstances, he is still allowed to claim self-defense under the law if he felt that he was reasonably threatened with severe harm from someone else. And once he does that, the prosecution has to disprove that belief.
The burden is on the prosecution. All right, what evidence do you think gave the jurors some reasonable doubt that maybe Rittenhouse did do it in self-defense?
Well, I think the entire environment in Kenosha that night, which jurors got to see through all of the video evidence that was submitted, was chaotic. It was dangerous. There were a lot of people going about armed. There were a lot of people engaged in confrontations with each other, verbal confrontations. Some of them started to become more physical. It was definitely a chaotic environment.
Mm-hmm.
I think as to the first shooting with Mr. Rosenbaum, there was some evidence that he was behaving somewhat erratically, maybe aggressively, daring people to shoot him. And so I think under all of those circumstances, I just don't think the prosecution could prove that Mr. Rittenhouse did not act in self-defense.
Now, are jurors only supposed to consider, in considering self-defense, only that singular moment when the shooting actually happened, or are they supposed to consider actions taken before that, leading up to that point?
Jurors can consider actions before that point. And in fact, if you are the person who provokes the confrontation or the fight, if you are the aggressor, then you are not entitled to use self-defense. Now, of course, many people are probably saying, how is he not the aggressor if he's carrying that type of weapon, if he's out late at night for no good reason in Kenosha? Isn't he looking for trouble? And my response to that is to say, although that is a reasonable way to look at the case, Wisconsin has an open carry law that actually permits people to carry those types of weapons openly. And in the law, it says that when people do that, it is not a provocation. Even though people may feel differently. Again, the law here was very much on his side, even though people feel like it should not have been.
I know you're in Wisconsin, but if he were here in California, if that trial were held here in California, would the definition and the outcome have been different? Could it have been?
It very well could have been. I mean, states are not wedded to this construction of self-defense that Wisconsin has. States obviously can make laws regulating the carrying of firearms. They can attempt to prohibit open carrying of firearms, particularly certain types of firearms that might put other people in reasonable fear and might create an environment that is disruptive and disorderly. And so you could very much get a different result in this case in a different state with a different construction of the law. But in Wisconsin, the way the law was, the acquittal here was not a surprise.
Okay. You know, a reasonable verdict under Wisconsin law, if not under a lot of opinions based on, you know, moral things, not legal things. But I want to ask you, what does this suggest, though? Do you think the law as it pertains to self-defense needs to change?
I think this verdict is going to cause a lot of people to ask that question. They're going to ask, why is this self-defense? It doesn't, for lack of a better word, feel to us, the community, the broader community, that this should be conduct that is not criminal. Now, having said that, right, the jury isn't passing judgment on the morality of his conduct, the wisdom of his conduct. All they're suggesting with their verdict, all they're saying with their verdict is it wasn't proven beyond a reasonable doubt. But people have questions as to why, under all of these circumstances, he leaves the court with being acquitted on all those charges. And I think, you know, that's an important question to ask. Why did that happen?
All right, we have about 30 seconds, but I'd like to ask you if he could, I know he cannot be criminally charged again for this in Wisconsin, but what about by federal prosecutors, and what about civilly?
He could definitely face civil suits for wrongful death, and the city of Kenosha may face a civil suit for wrongful death, considering that police were involved, at least in some sort of tacit approval of these folks wandering around the town with AR-15s. But he won't be charged federally. Federal civil rights violations are reserved for state actors, so police officers who violate someone's rights, and he's just a private citizen.
All right. John Gross, director of the Public Defender Project at the University of Wisconsin-Madison Law School, thank you so much for your insight. Really appreciate it.
Happy to be here. Thank you.
All right, we're going to shift gears coming up. Planning to fly for Thanksgiving? What you need to know before you board your flight. Be right back. All right, everybody, you want to stick around for our next guest, who is, I heard him on the radio. We're really excited about the information he has to offer. Has to do with how to get through Thanksgiving if you're traveling. So stick around for that. Welcome back. Flying next week for Thanksgiving or expecting a loved one to fly in to see you? Well, do expect a lot of company in the skies. Holiday flyers are back. You add that to the challenges facing the airlines right now, and you could have a recipe for delays and frustration. Joining us now is Brett Snyder, the founder of the blog crankyflyer.com, love the name, and president of Cranky Concierge Travel Assistance. Hi, Brett.
Hi, how are you?
Good. Thanks for joining us. Okay, so how busy do we expect this upcoming travel week to be?
It's going to be really busy. In fact, in some places, it may be more than we saw during the holidays in 2019. So it's a big change from what we've seen over the last year where just travel was dormant for so long.
So are the airlines equipped to handle that volume suddenly bouncing back?
Oh, we hope so, right? This is the big question.
Yeah.
The airlines have had some notable issues over the last few months, but this is always the peak time of year, Thanksgiving and then the Christmas, New Year holiday. That's when people are traveling. The airlines know that. They know they have to get it right. And so they have been taking as many steps as they can to make sure that they're ready to go.
Yeah, you referred to some of the, delays and cancellations we've already seen. Southwest had a few, American, and, they cited weather, but really we also know it was the flight attendants or crew, staffing shortages. So what have they done to try to entice people to work and stay on the job? And plus, also worried about the TSA, the vaccine deadline coming up on Monday, too.
Well, so there's a lot there. So first of all, what the airlines have done is they have tried to just use cold, hard cash. They're creating incentives for employees, basically giving them a bonus for showing up to work, which is a nice thing to have, I guess, if you're an employee. But they're trying to prevent high sick rates, people calling out. And that can happen around the holidays when people are scheduled to work and they just want to be with their families, whatever it may be. So they're trying to push to make sure that doesn't happen. And then on top of that, they also are just preparing for peak travel. They know that this is the peak time, and so they can put their operations into gear for that as well. And then, I'm sure there's a piece of it as well where they're just sitting there and hoping there's not a giant snowstorm to take out the East Coast.
I was going to say, how's that looking right now? Because we had heard some forecasts for next week that, are somewhat problematic, I think in Michigan, Chicago, and maybe on the East Coast.
Yeah, there were some early predictions that there could be a nasty winter storm that would climb along the East Coast, but it sounds like now it's not going to be as bad as they think. If there is something there, it might be more rain than snow, which would be good. So far, it doesn't look like it's going to be too bad right now, but we also don't know, next Sunday is a huge travel day for everyone coming home. That's too far out to know really what that looks like. So we'll just have to keep our fingers crossed and hope it'll go smoothly there.
Yeah, you mentioned next Sunday, everybody coming back. That's the single busiest day. But what about the heading out for Thanksgiving? When do we expect to see the peaks? Or I know there are mini peaks too.
There are, and it can start as soon as today. I can tell you, my kids have all of next week off, so we can go. Today, tomorrow, people will start there. They'll travel this weekend, take the full week, and especially now when people don't necessarily have to be at work, they can work remotely. More people may look to do that. I don't know exactly what the bookings look like specifically for this year, but often you will see Wednesdays, of course, being a really busy day, and that bleeds into Thursday morning, people trying to go a little bit more off peak, maybe save a little money, but still get there in time for dinner. Okay.
So it sounds like if you're trying to avoid the crowds and save a little money, like Thursday morning is a good time to go, right? All right.
It can be.
And come back Saturday maybe instead of Sunday?
Yeah, you can try and come back Saturday, but the reality is you probably won't avoid the crowds too much because the airlines have gotten so much better at this. They know if there's more demand on Sunday, they'll fly a lot more flights. But on Saturday, they'll just fly fewer flights and demand will still fill up the flights that they have.
Got it. You still probably won't get that road to yourself. Brett, many people haven't been on a plane since the pandemic started. And, you have the recreational traveler as opposed to the regulars. What do those folks need to know?
Yeah, that's absolutely true right now. Last year, almost nobody traveled. And if they did, they probably didn't travel by airplane. So you have a lot of people that have not been on an airplane in a really long time and probably a little more stressed, a little more trepidatious about exactly what it's going to be like. So the bulk of the experience is not much different. When you get to the airport, you will see a lot more of those plastic barriers separating you from others. But there's, not as much room for social distancing when you have a packed house. So you don't really see much of that. But of course, everyone will be wearing masks, and that's still federal law. You have to wear a mask on an airplane. And that's not going to change in the next month or two. So people need to be ready for that, for sure, unless they're actively eating or drinking. And some airlines have pulled back on their services a little bit. So there are still some airlines that don't serve alcohol. There are others that have more limited beverage service. They try to limit the interactions. But it shouldn't be a huge change for most people. The most visible thing is the masks. But other than that, it should be not much different. It'll still be an airplane.
Well, Brett, don't go away because we have to take a break on the air. But if you join us on Facebook Live and YouTube, we'll talk about international travel rules and how to get through the airport quickly. Be right back. All right, Brett, we're off air, but we still have a couple minutes to chat here on Facebook Live to finish up. So I'm going to ask you what I'm really interested in, which is what do people need to know if they are traveling internationally over the holidays with regard to any possible, testing rules or vaccine-proof rules or quarantine rules?
Yeah, this is probably the most stressful thing for people right now, because depending on where you're going, the rules can completely vary from country to country. And so I'm particularly curious to see how this changes between now and, say, Christmas time, because you have in Europe where there are different waves that are starting to come back again over there. Austria is talking about going back into lockdown. So, those are things that we have to keep watching, and something that you definitely want to make sure if you're traveling that you can look at the rules now, but know that check again before you go, because there's a decent chance they may change.
I think Germany too, I read today, right? They're considering it anyway. So, okay, you got to check because it could change quickly. What about just packing? Any packing tips for getting through checkpoints and in and out of the airport quickly?
It's the same as it always is for packing, right? I mean, if you're going to be carrying bags on the plane, make sure you have your liquids in their 3-ounce containers in their bags and all that kind of stuff. But and then there's the usual of if you're going to be bringing presents, don't wrap them until you get where.
Right. Because they might unwrap it for you or tell you to, right? Okay, how about travel insurance? Should you get it these days? Because it seems like less of a need given the fact that a lot of airlines have lifted their change fees.
Yeah, so specifically for airlines, you don't really necessarily need insurance. I mean, you can always have it, and sometimes you might want the type of insurance that'll provide the medical assistance. That's maybe more important than getting your money back. Most insurance policies, and there are some companies that have exclusively medical policies. Those can be really helpful, especially in an uncertain time like this. But when it comes to getting money back.
Thank you. I think we're out of time, but Brett Snyder, crankyflyer.com. Folks can check it out on his blog. Thank you. Thanks so much for joining us today on this interactive show, Getting Answers. We'll be here every weekday at 3 for you on air and on live stream answering your questions. World News Tonight is next, and I'll see you at 4.